1. When assisting a patient with ambulation, the CNA should always A. Walk behind the patient. B. Use a gait belt for safety. C. Let the patient hold onto furniture only. D. Encourage the patient to walk independently without support. 2. What is the most appropriate action when a patient begins to fall while ambulating? A. Try to catch the patient fully. B. Ease the patient to the floor safely. C. Call for help and leave the patient. D. Pull the patient up immediately. 3. Which of the following is a normal range for adult body temperature when measured orally? A. 96.8 degrees Fahrenheit to 98.6 degrees Fahrenheit. B. 98.6 degrees Fahrenheit to 100.4 degrees Fahrenheit. C. 97.6 degrees Fahrenheit to 99.6 degrees Fahrenheit. D. 96.0 degrees Fahrenheit to 99.0 degrees Fahrenheit. 4. When providing oral care to an unconscious patient, the CNA must A. Use a toothbrush and toothpaste. B. Place the patient in a supine position. C. Use a suction device and sponge swabs. D. Offer fluids immediately after oral care. 5. How often should a patient in an acute care setting be repositioned to prevent pressure ulcers? A. Every 2 hours. B. Every 4 hours. C. Every 6 hours. D. Every 12 hours. 6. When emptying a urinary drainage bag, the CNA should A. Place the bag on the floor. B. Wear gloves and wipe the drain with antiseptic. C. Open the drainage valve without gloves. D. Clamp the tube before emptying. 7. A patient is on strict bed rest. What is the CNA's responsibility? A. Encourage the patient to walk twice a day. B. Assist with range of motion exercises. C. Turn off all lights in the room. D. Limit all fluids. 8. How should a CNA handle used bed linens contaminated with body fluids? A. Place linens in the dirty linen hamper immediately. B. Shake linens to remove debris before disposal. C. Place linens on the floor until laundry arrives. D. Fold linens and reuse if not visibly soiled. 9. The first sign of hypoxia in a patient may include A. Cyanosis. B. Rapid pulse. C. Restlessness or anxiety. D. Bradycardia. 10. What is the correct way to measure a patient's pulse? A. Use the carotid artery for 10 seconds. B. Use the radial artery for 30 seconds and multiply by 2. C. Use the brachial artery for 60 seconds. D. Use the femoral artery for 15 seconds. 11. Which type of diet would be ordered for a patient with difficulty swallowing? A. Mechanical soft. B. Full liquid. C. Clear liquid. D. Regular diet. 12. A patient with a nasogastric tube NG tube requires A. Oral intake of fluids unrestricted. B. Careful monitoring of tube placement and patency. C. Frequent ambulation without assistance. D. Use of thickened liquids only. 13. How often should the CNA check on a patient who is on oxygen therapy? A. Every 4 hours. B. Every hour. C. As ordered by the nurse. D. Only when the patient calls. 14. When feeding a patient with dysphagia, the CNA should A. Encourage fast eating to finish quickly. B. Offer thin liquids only. C. Position the patient upright at 90 degrees. D. Allow the patient to lie down during feeding. 15. Which of the following is a sign of dehydration in an acute care patient? A. Moist mucous membranes. B. Turgor that returns slowly when pinched. C. Frequent urination. D. Bradycardia. 16. When assisting a patient with dressing, the CNA should A. Put the garment on the stronger side first. B. Allow the patient to choose clothing only. C. Avoid asking the patient for preferences. D. Dress the weaker side first. 17. Which of the following statements about catheter care is correct? A. The catheter bag should be placed above the bladder. B. The catheter tubing should be kinked to prevent backflow. C. The catheter insertion site should be cleaned daily. D. The catheter can be disconnected from the drainage bag for mobility. 18. A patient has a feeding tube. How should the CNA prevent aspiration during feeding? A. Keep the patient flat during feeding. B. Ensure the patient is in a semi-Fowler's position. C. Offer water after feeding. D. Remove the tube after feeding. 19. When applying antiembolism stockings TED hose, the CNA must A. Ensure they are rolled down halfway. B. Apply them before the patient gets out of bed. C. Leave them on continuously without removal. D. Make sure there are wrinkles in the stockings. 20. The proper way to wash a patient's eyes is to A. Use the same area of the washcloth for both eyes. B. Use a different section of the washcloth for each eye. C. Use soap on the eyes. D. Rub vigorously to clean thoroughly. 21. The best way to prevent the spread of infection is A. Wearing gloves only. B. Proper hand hygiene. C. Wearing a mask at all times. D. Using antibacterial wipes only. 22. When should a CNA wash their hands? A. Before and after patient contact only. B. After using the restroom and before eating only. C. Before and after patient care, and after removing gloves. D. Once per shift. 23. Which of the following is considered a healthcare-associated infection HAI? A. Common cold. B. Urinary tract infection after catheterization. C. Seasonal flu. D. Skin rash from allergies. 24. What is the correct order for donning personal protective equipment PPE? A. Gloves, gown, mask, goggles. B. Mask, gown, gloves, goggles. C. Gown, mask, goggles, gloves. D. Mask, gloves, gown, goggles. 25. A patient with tuberculosis TB is placed under what type of precautions? A. Contact precautions. B. Droplet precautions. C. Airborne precautions. D. Standard precautions. 26. Which item is not disposable and should be cleaned and disinfected after use? A. Syringe. B. Stethoscope. C. Gloves. D. Bandages. 27. When handling a needle stick injury, the CNA should A. Ignore it if it does not bleed. B. Report immediately to the nurse or supervisor. C. Wash the area with alcohol only. D. Continue working without reporting. 28. The term standard precautions means: A. Treat all blood and body fluids as if they are infectious. B. Only wear gloves when blood is visible. C. Use hand sanitizer only after patient contact. D. Wear a mask during all procedures. 29. To safely lift a heavy patient, the CNA should: A. Use proper body mechanics and ask for assistance. B. Lift with the back muscles only. C. Twist the torso while lifting. D. Keep feet close together for balance. 30. Which of the following is a potential fire hazard in the hospital setting? A. Oxygen tanks stored near electrical equipment. B. Proper disposal of flammable waste. C. Clear exit paths. D. Fire extinguishers in place. 31. What does the acronym RACE stand for in fire safety? A. Rescue, alarm, contain, extinguish. B. Run, alert, close, exit. C. React, assist, call, evacuate. D. Rescue, alert, contain, evacuate. 32. A patient complains of chest pain and shortness of breath. The CNA should: A. Immediately notify the nurse. B. Give the patient water. C. Ask the patient to lie down and rest only. D. Ignore if pain is mild. 33. When transferring a patient from bed to wheelchair, the CNA should: A. Lock the wheelchair brakes. B. Ensure the wheelchair is facing backward. C. Let the patient stand without assistance. D. Push the patient without assistance. 34. Which of the following is the best way to identify a patient before care? A. Ask the patient their name and check the ID bracelet. B. Check the room number only. C. Use the patient's chart name only. D. Ask the patient's roommate. 35. If a patient refuses care, the CNA should: A. Force the care for safety. B. Document the refusal and notify the nurse. C. Ignore and provide care anyway. D. Ask another CNA to provide care. 36. What is the first thing a CNA should do when discovering a patient on the floor? A. Attempt to lift the patient immediately. B. Assess for injuries and call for help. C. Leave the patient to get the nurse. D. Move the patient to the bed. 37. How should the CNA respond to a call light for help when they are busy with another patient? A. Wait until finished, then respond. B. Ask another staff member to assist. C. Ignore the call light. D. Respond immediately, even if leaving another patient. 38. When is it appropriate to use restraints on a patient? A. When the patient is confused and at risk of harming self or others. B. When the patient refuses care. C. To punish the patient. D. Anytime the patient moves without permission. 39. How should the CNA store clean linens? A. On the floor. B. In a clean, dry, covered area. C. Next to the dirty linen cart. D. In the patient's room. 40. Which sign indicates a patient may be at risk for falls? A. Young age. B. History of falls and muscle weakness. C. Use of a walker or cane. D. Normal vision and hearing. 41. A CNA should report which of the following to the nurse immediately? A. Patient complains of mild itching. B. Patient shows signs of respiratory distress. C. Patient prefers to wear own clothes. D. Patient requests water. 42. The best way to communicate with a hearing-impaired patient is to A. Speak loudly from another room. B. Face the patient and use clear lip movements. C. Use written notes only. D. Speak quickly to get the message across. 43. Which action shows professional behavior by a CNA? A. Gossiping about patients with coworkers. B. Keeping patient information confidential. C. Arriving late for the shift regularly. D. Ignoring patients' requests. 44. If a patient becomes angry and yells, the CNA should A. Yell back to establish control. B. Remain calm and speak softly. C. Leave the patient alone indefinitely. D. Call security immediately. 45. Which of the following should not be shared about a patient? A. Patient's diagnosis with family members without consent. B. Information needed for patient care during shift report. C. Patient preferences to the nursing team. D. Observations relevant to treatment plan. 46. What is the best response when a patient asks a question the CNA cannot answer? A. Ignore the question. B. Provide incorrect information to reassure the patient. C. Tell the patient you will ask the nurse and get back to them. D. Tell the patient to ask a family member. 47. Which of the following is an example of active listening? A. Interrupting to provide advice. B. Nodding and making eye contact. C. Looking at your watch while the patient talks. D. Talking about your own experiences. 48. A CNA's scope of practice includes A. Administering medications. B. Performing invasive procedures. C. Assisting with activities of daily living. D. Diagnosing illnesses. 49. The term advocacy means A. Speaking up for the patient's rights and needs. B. Making decisions for the patient without consent. C. Ignoring patient complaints. D. Following orders without question. 50. Confidentiality means A. Sharing patient information only with authorized personnel. B. Discussing patients in the cafeteria. C. Posting about patients on social media. D. Talking about patients with friends. 51. How should a CNA handle an ethical dilemma? A. Make a decision alone. B. Discuss concerns with the nurse or supervisor. C. Ignore the issue. D. Share details with other patients. 52. A CNA must wear an ID badge to A. Identify themselves to patients and staff. B. Use the cafeteria. C. Enter the building. D. Avoid responsibility. 53. Which of the following behaviors is unprofessional? A. Reporting errors immediately. B. Arriving well-groomed and in uniform. C. Using slang while talking to patients. D. Respecting patient privacy. 54. When documenting care, the CNA should A. Use subjective terms like seems fine. B. Write clearly, objectively, and timely. C. Document at the end of the day only. D. Leave out abnormal findings. 55. What should a CNA do if asked to perform a task outside their scope of practice? A. Perform the task to help the patient. B. Refuse and report to the nurse. C. Ignore the request. D. Ask another CNA to do it. 56. How should a CNA respond to cultural differences in patient care? A. Respect and accommodate cultural preferences. B. Ignore differences. C. Correct the patient's beliefs. D. Refuse care if preferences differ. 57. If a patient refuses medication, the CNA should A. Force the patient to take it. B. Report the refusal to the nurse immediately. C. Ignore the refusal. D. Give medication later without telling the nurse. 58. When communicating with a visually impaired patient, the CNA should A. Speak loudly. B. Describe activities and surroundings clearly. C. Avoid talking about the environment. D. Use hand gestures only. 59. How should a CNA address a patient to maintain dignity? A. Use the patient's preferred name and title. B. Use nicknames to seem friendly. C. Talk to the caregiver only. D. Ignore the patient's preferences. 60. The best way to handle a conflict with a coworker is to A. Discuss the problem calmly and seek resolution. B. Gossip about the coworker. C. Avoid the coworker entirely. D. Complain to patients. 61. The heart is part of which body system? A. Respiratory. B. Circulatory. C. Digestive. D. Nervous. 62. Which organ is primarily responsible for filtering blood? A. Liver. B. Kidney. C. Lung. D. Stomach. 63. The term ventilation refers to A. Circulation of blood. B. Movement of air in and out of the lungs. C. Digestion of food. D. Movement of muscles. 64. The large intestine's main function is to A. Absorb nutrients. B. Absorb water and form stool. C. Produce enzymes. D. Filter toxins. 65. Which part of the brain controls balance and coordination? A. Cerebrum. B. Cerebellum. C. Brainstem. D. Hypothalamus. 66. Which blood type is known as the universal donor? A. B positive. B. O minus. C. A positive. D. B minus. 67. The skin is part of which body system? A. Endocrine. B. Integumentary. C. Muscular. D. Skeletal. 68. The functional unit of the kidney is the A. Neuron. B. Nephron. C. Alveolus. D. Nephritis. 69. Which muscle type is under voluntary control? A. Smooth muscle. B. Cardiac muscle. C. Skeletal muscle. D. Involuntary muscle. 70. The respiratory system includes all except A. Trachea. B. Alveoli. C. Bronchi. D. Esophagus. 71. The term proximal means A. Far from the point of attachment. B. Near the point of attachment. C. On the backside. D. Toward the front. 72. The liver's function includes A. Producing insulin. B. Detoxifying harmful substances. C. Pumping blood. D. Absorbing nutrients. 73. What is the main function of red blood cells? A. Fight infection. B. Carry oxygen. C. Clot blood. D. Regulate temperature. 74. Which organ produces insulin? A. Pancreas. B. Kidney. C. Liver. D. Spleen. 75. The smallest bones in the body are found in the A. Hand. B. Ear. C. Foot. D. Spine. 76. The nervous system transmits messages through A. Blood vessels. B. Neurons. C. Muscles. D. Hormones. 77. The skeletal system provides all except A. Support and protection. B. Movement. C. Blood cell production. D. Hormone secretion. 78. The normal adult respiratory rate is approximately A. 8 to 12 breaths per minute. B. 12 to 20 breaths per minute. C. 20 to 30 breaths per minute. D. 30 to 40 breaths per minute. 79. Which organ stores bile? A. Gallbladder. B. Liver. C. Stomach. D. Pancreas. 80. The term distal means A. Near the point of attachment. B. Away from the point of attachment. C. Towards the front of the body. D. Below the waist. 81. When a patient is choking and cannot cough or speak, the CNA should A. Perform abdominal thrusts Heimlich maneuver. B. Encourage the patient to cough harder. C. Give water to help dislodge the object. D. Call family to assist. 82. Which of the following signs requires immediate intervention? A. Blood pressure 120/80. B. Respiratory rate 30 with labored breathing. C. Pulse of 70 bpm. D. Temperature of 98.6 degrees Fahrenheit. 83. When assisting with a sterile dressing change, the CNA must A. Touch only the outside of the dressing package. B. Use sterile gloves and maintain a sterile field. C. Clean the wound with bare hands. D. Remove old dressing without gloves. 84. A patient's oxygen saturation is 85%. This is considered A. Normal. B. Low, notify nurse immediately. C. High, no action needed. D. Within acceptable range for all patients. 85. The purpose of suctioning a patient's airway is to A. Remove secretions that obstruct breathing. B. Provide hydration. C. Administer medication. D. Stimulate coughing. 86. If a patient experiences a seizure, the CNA should A. Hold the patient down tightly. B. Move objects away and protect the head. C. Place a spoon in the patient's mouth. D. Leave the patient alone. 87. Which of the following signs indicates shock? A. Warm, dry skin. B. Pale, clammy skin and rapid pulse. C. Elevated blood pressure. D. Slow breathing. 88. When performing CPR, the correct compression rate is A. 60 compressions per minute. B. 100 to 120 compressions per minute. C. 140 compressions per minute. D. 200 compressions per minute. 89. Which patient is at highest risk for developing deep vein thrombosis DVT? A. A mobile patient after surgery. B. A bedridden patient with limited movement. C. A patient with a cold. D. A patient with a broken arm only. 90. What should the CNA do if a patient becomes unresponsive? A. Shake the patient and shout. B. Call for help and begin CPR if trained. C. Wait for the nurse. D. Leave to get family. 91. When using a mechanical lift, the CNA must A. Ensure the sling is placed correctly and follow safety protocols. B. Lift the patient manually. C. Ignore the patient's comfort. D. Operate without assistance. 92. A patient with a tracheostomy requires A. Frequent suctioning and care of the site. B. Removal of the tube daily. C. No special care beyond oral hygiene. D. Only physician care. 93. Which symptom indicates hypoglycemia in a diabetic patient? A. Shaking, sweating, confusion. B. Excessive thirst and urination. C. Fever and chills. D. Slow pulse. 94. The purpose of a chest tube is to A. Drain air or fluid from the pleural space. B. Deliver oxygen. C. Measure blood pressure. D. Monitor heart rate. 95. A patient with a newly placed foreline complains of pain and swelling at the site. The CNA should A. Report immediately to the nurse. B. Apply heat immediately. C. Remove the fore. D. Ignore the complaint. 96. How should the CNA respond if a patient is having difficulty breathing? A. Sit the patient up and call the nurse immediately. B. Lay the patient flat. C. Give the patient water. D. Encourage slow breathing only. 97. What is the proper procedure to take a rectal temperature? A. Insert the thermometer 1 inch into the rectum. B. Insert the thermometer 3 to 4 inches into the rectum. C. Use a standard oral thermometer. D. No special procedure needed. 98. When assisting a patient with a new cast, the CNA should: A. Check for circulation, movement, and sensation frequently. B. Remove the cast to check the skin. C. Soak the cast daily. D. Ignore patient complaints of numbness. 99. Which of the following is a sign of respiratory distress? A. Slow, deep breathing. B. Use of accessory muscles and nasal flaring. C. Calm, even breathing. D. Clear speech without coughing. 100. How often should vital signs be taken on an acute care patient? A. As ordered by the nurse or care plan. B. Once per shift only. C. Every 4 hours regardless of condition. D. Only when the patient complains. 101. Patients have the right to: A. Refuse treatment. B. Receive care only when convenient. C. Know nothing about their condition. D. Make decisions for others. 102. Informed consent means: A. Patient agrees after understanding risks and benefits. B. Patient signs papers without explanation. C. Family decides for the patient without informing them. D. Consent is not needed in emergencies. 103. If a CNA suspects abuse or neglect, they must: A. Report it immediately to the nurse or supervisor. B. Confront the abuser directly. C. Ignore it to avoid trouble. D. Discuss with other patients. 104. Which of the following is an example of invasion of privacy? A. Closing the door during care. B. Sharing patient information with unauthorized persons. C. Covering a patient during a procedure. D. Asking permission before care. 105. A durable power of attorney for healthcare means: A. The patient's appointed person can make healthcare decisions if the patient cannot. B. The patient loses all rights. C. The CNA makes all decisions. D. Family is not involved. 106. Which of the following is a legal responsibility of the CNA? A. Providing accurate documentation. B. Diagnosing illnesses. C. Prescribing medication. D. Making treatment plans. 107. Negligence occurs when: A. The CNA intentionally harms the patient. B. Care is omitted or improperly performed resulting in harm. C. The CNA follows all orders carefully. D. The nurse makes a mistake. 108. A CNA witnesses a coworker stealing medications. The CNA should: A. Report the incident to a supervisor. B. Ignore it to avoid conflict. C. Join the coworker. D. Tell patients about it. 109. Which action is considered professional misconduct? A. Arriving on time. B. Sharing patient information on social media. C. Reporting patient falls. D. Following infection control protocols. 110. The Health Insurance Portability and Accountability Act HIPAA protects: A. Patient confidentiality and privacy. B. CNA wages. C. Hospital profits. D. Visitors' access to patient information. 111. What is the best way to prevent medication errors? A. Administer all medications quickly. B. Verify patient identity and medication orders carefully. C. Guess doses when unsure. D. Skip documentation if busy. 112. If a patient refuses a treatment, the CNA should A. Document the refusal and inform the nurse. B. Force the treatment. C. Ignore the refusal. D. Offer treatment to someone else. 113. An advance directive is A. A written document outlining a patient's wishes about medical care. B. A doctor's order only. C. A legal document for billing. D. Not legally binding. 114. The CNA's primary responsibility in reporting errors is to A. Cover up mistakes to avoid blame. B. Report promptly and honestly to prevent harm. C. Wait until the nurse asks. D. Ignore minor errors. 115. Patients' rights include the right to A. Receive considerate and respectful care. B. Refuse care only when seriously ill. C. Be transferred without notice. D. Have their care decided by staff only. 116. What should a CNA do if asked to falsify documentation? A. Comply quietly. B. Refuse and report the request. C. Modify records later. D. Leave it blank. 117. The term confidentiality means A. Sharing information only with the care team. B. Discussing patient details with friends. C. Posting about patients online. D. Ignoring privacy rules. 118. Which of the following is considered abuse? A. Gently repositioning a patient. B. Ignoring a patient's call light repeatedly. C. Helping with hygiene. D. Encouraging fluid intake. 119. When a patient expresses fear or anxiety, the CNA should A. Listen actively and provide reassurance. B. Dismiss the feelings. C. Tell the patient to stop worrying. D. Avoid contact. 120. The term scope of practice refers to A. The tasks and duties a CNA is legally allowed to perform. B. Duties assigned by family members. C. Tasks performed by doctors only. D. Personal preferences of the CNA. 121. The most important way to prevent infection is A. Using antibiotics. B. Hand hygiene. C. Wearing gloves at all times. D. Cleaning equipment monthly. 122. When should a CNA wash hands? A. Before and after patient contact. B. Only at the start of the shift. C. Once a day. D. Only after bathroom use. 123. Personal protective equipment PPE includes A. Gloves, gowns, masks, and eye protection. B. Uniform only. C. Shoes and hats. D. Patient clothing. 124. What is the correct order for donning PPE? A. Gown, mask, goggles, gloves. B. Gloves, gown, mask, goggles. C. Mask, gloves, gown, goggles. D. Goggles, gown, gloves, mask. 125. Which of the following requires standard precautions? A. Contact with blood or body fluids. B. Talking to a patient. C. Walking in the hallway. D. Using a computer. 126. What is the best way to dispose of sharps? A. In a puncture-proof sharps container. B. In the regular trash. C. Flush down the toilet. D. On the floor near the bed. 127. If a CNA is exposed to blood, the first step is to A. Wash the area with soap and water immediately. B. Ignore it if no injury is visible. C. Wait until the end of the shift. D. Report only if symptoms develop. 128. How often should linen be changed in an acute care setting? A. When soiled or at least daily. B. Weekly. C. Only on patient request. D. Monthly. 129. Which of the following is a sign of a fire emergency? A. Smell of smoke in visible flames. B. Normal alarms. C. Power outage. D. Noise from the hallway. 130. What does RACE stand for in fire safety? A. Rescue, alarm, confine, extinguish. B. Run, alert, call, exit. C. Rest, assess, care, evacuate. D. Remove, avoid, confuse, exit. 131. Which side should the CNA position themselves on when assisting a patient with a weak side? A. Strong side. B. Weak side. C. Either side. D. Behind the patient. 132. The safest way to prevent falls in patients is A. Keep frequently used items within reach and assist with mobility. B. Leave patients alone in the bathroom. C. Remove all furniture from the room. D. Ignore patient requests for assistance. 133. Which equipment is used to measure blood pressure? A. Stethoscope and sphygmomanometer. B. Thermometer. C. Pulse oximeter. D. Glucometer. 134. When assisting a patient with a wheelchair, the CNA should A. Lock the wheels before transferring. B. Push the wheelchair with unlocked wheels. C. Lift the wheelchair. D. Leave the patient unattended. 135. What is the correct way to store clean supplies? A. In a clean, dry area off the floor. B. On the floor. C. Mixed with used supplies. D. Near the sink. 136. What is an important safety measure when using a mechanical lift? A. Check the equipment before use. B. Use only once per day. C. Ignore patient comfort. D. Use without training. 137. How should spills of blood or body fluids be cleaned? A. Using appropriate disinfectant and gloves. B. Using water only. C. Ignoring if small. D. Sweeping it into the trash. 138. Which of the following is a symptom of an allergic reaction? A. Rash, itching, swelling. B. Headache only. C. Fever. D. Nausea without skin changes. 139. The purpose of hand sanitizer is to A. Kill germs when hands are not visibly soiled. B. Replace hand washing always. C. Moisturize hands. D. Remove dirt physically. 140. The most common hospital-acquired infection is A. Urinary tract infection UTI. B. Chickenpox. C. Tuberculosis. D. Influenza. 141. When a patient is on a fluid restriction, the CNA should A. Offer unlimited water. B. Measure and record all fluids taken and notify nurse if limits are exceeded. C. Ignore fluid intake. D. Encourage drinking more fluids. 142. A patient with a feeding tube should be positioned at A. 15 degrees. B. 30 to 45 degrees. C. Lying flat. D. Trendelenburg position. 143. When a patient has a catheter, the CNA should A. Keep the drainage bag below the bladder level. B. Keep the drainage bag above the bladder level. C. Empty the catheter frequently without gloves. D. Disconnect the catheter tubing regularly. 144. Which of the following symptoms requires immediate reporting in a patient with a urinary catheter? A. Clear, light yellow urine. B. Cloudy, foul-smelling urine and fever. C. No urine output for 2 hours. D. Both B and C. 145. What is the purpose of a care plan? A. To guide care and ensure consistency among caregivers. B. To assign blame for mistakes. C. To decorate the patient's room. D. To reduce paperwork. 146. When assisting a patient with ambulation, the CNA should A. Use a gait belt and assist as needed. B. Let the patient walk alone immediately after surgery. C. Pull the patient by the arms. D. Ignore patient complaints of dizziness. 147. How should the CNA handle a patient with a communication barrier, such as hearing impairment? A. Speak slowly and clearly, use gestures or written communication. B. Speak loudly and quickly. C. Avoid communication. D. Use medical jargon. 148. Which of the following is an example of therapeutic communication? A. Active listening and responding with empathy. B. Changing the subject when patient talks about feelings. C. Ignoring patient's questions. D. Giving unsolicited advice. 149. When documenting patient care, the CNA should A. Use subjective language. B. Document only what was observed or done. C. Document opinions and assumptions. D. Delay documentation until end of shift. 150. The CNA observes a patient's skin is pale and clammy. The best action is to A. Notify the nurse immediately. B. Document and ignore. C. Give the patient food. D. Encourage the patient to walk. 151. How often should range of motion ROM exercises be performed on a bedridden patient? A. Once per week. B. Twice daily or as ordered. C. Only when the patient requests. D. Not needed. 152. When caring for a patient with a wound, the CNA should A. Report any redness, swelling, or discharge to the nurse. B. Clean the wound with any available solution. C. Change the dressing without gloves. D. Ignore complaints of pain. 153. A patient is receiving oxygen via nasal cannula. The CNA should A. Check tubing for kinks and ensure it fits properly. B. Remove oxygen when patient sleeps. C. Adjust oxygen flow without orders. D. Place cannula under the patient's chin. 154. The best way to prevent pressure ulcers is A. Repositioning the patient frequently. B. Using special pillows only. C. Limiting fluid intake. D. Avoiding movement. 155. Which of the following signs may indicate a stroke? A. Sudden weakness on one side, slurred speech, and facial drooping. B. Gradual memory loss. C. Chest pain. D. Coughing. 156. A patient has a history of falls. The CNA should A. Keep the call light within reach and assist with all transfers. B. Let the patient try to walk alone. C. Leave the room frequently. D. Ignore fall precautions. 157. When transporting a patient in a wheelchair down a ramp, the CNA should A. Move backward, facing the patient. B. Push forward quickly. C. Leave the patient unattended. D. Tilt the wheelchair backward constantly. 158. Which of the following is a sign of dehydration? A. Dry mouth, decreased urine output, and dizziness. B. Excessive sweating. C. Frequent urination. D. Clear urine. 159. What is the best way to handle a patient who is angry or agitated? A. Remain calm, listen, and avoid arguing. B. Raise voice to assert authority. C. Ignore the patient. D. Restrain immediately. 160. Which of the following is an appropriate way to handle a patient's personal belongings? A. Label and store belongings safely. B. Leave belongings on the floor. C. Give them to another patient. D. Dispose of unwanted items without consent. Acute Care Certified Nursing Assistant CNA. The Acute Care Certified Nursing Assistant CNA test is a specialized examination designed to assess the knowledge and clinical skills of CNAs working in fast-paced, high-acuity healthcare environments such as hospitals, emergency departments, and intensive care units. This exam evaluates a CNA's ability to perform essential duties like monitoring vital signs, assisting with mobility, responding to medical emergencies, and supporting patients with complex medical needs. Candidates are also tested on infection control, communication, and the use of specialized equipment. The goal is to ensure CNAs are prepared to deliver safe, competent, and compassionate care in acute settings under the supervision of registered nurses and medical staff. Here are the top 5 beneficial uses of the sample exam. 1. Credential validation. The test verifies that CNAs possess the specialized skills and knowledge necessary for working in acute care settings, ensuring they meet a higher standard of clinical competence. 2. Enhanced employment opportunities. Passing the test can lead to better job prospects in hospitals and other acute care facilities where skilled CNAs are in high demand. 3. Improved patient safety and care. Certified acute care CNAs are better prepared to assist with complex medical conditions, which leads to more accurate care delivery and better patient outcomes in high-stress environments. 4. Career advancement. It opens pathways to advanced roles or specialized nursing positions, supporting long-term professional growth. 5. Workforce standardization. The test helps healthcare facilities ensure a consistent level of competency among staff, promoting efficiency and teamwork.